All right, well, hello, Float Magic fans. Shani coming to you in the Salt Cave with Marie Garcia from over at Infused Health. She's a family nurse practitioner over there. They do infusion therapies, and we are collaborating on a package for the upcoming months. So I thought it'd be a great opportunity to have them come on and kind of share what they do and why we're collaborating on this. So Marie, welcome to the podcast.
Well, thank you so very much for having me. We're definitely excited to partner with another local business just to bring together services to just help clients the best that we can to just feel the best that they can.
Awesome. Yeah. And that's what we're going into is this season where we all want to be at our best capacity to feel good. And there's a lot attacking that right now with the sicknesses that are going around and the cold that we face. And so tell us a little bit about what you do over at Infused Health.
So our clinic is an outpatient infusion clinic. We're independently owned. It's myself, a CRNA, and a registered nurse. And we have all kinds of different infusions that we offer. We do vitamin infusions, medical infusions, and injections to help with chronic illness.
Awesome. And so what do you see a lot of people looking for right now?
Definitely the immunity boost. In the winter months, everybody's sick. Kiddos are at home. You know, they've brought the germs home from school. Everybody's just feeling down and run down from the holidays and all the stress of that. So definitely for energy and immunity.
Yeah. So I had my own personal opportunity to get an injection with you guys. You guys gave me the vitamin D shot and a vitamin B12 shot. I got whatever sickness was going around, one of them, because there has been several in the community. And usually I'm a 3 to 4 day recovery person, and I'm right back at it. And I was not popping right back. Went in and got those injections, came back and did my Novathor in Salt Cave, and I felt immensely better the next day. I felt like my body just needed that little additional push.
And that's awesome
get
to
me
hear.
Over the hump. So yeah, I was appreciative to you guys for that. So
I'm so glad.
Yeah.
I really like the vitamin B12 and vitamin D injections together. Most of us are deficient on that anyway, especially when we get into the colder, darker months that the sun's not out. So it definitely helps to have those two vitamins working together to just really boost you up.
Awesome. Yeah, I definitely felt that boost. And it was kind of a testament as to why I'm glad that we're partnering, because being able to take your services, your injections, and then come over and do some of my services that actually activate the cell response when you have those vitamins in your body, it just expedited that recovery process. And so coming in here in this salt cave and breathing in that salt when my body was already in this boosted immune state was really a great benefit. It was night and day the next day. I felt so much better. I didn't recover completely. This sickness was like a 10-day process, and I've heard that with a lot of people. However, I was so manageable because we were going into the holidays and had family coming into town, and I was able to manage all of that. So
that's great to hear, for sure. I was so glad we could help you. And I think it's super important to recognize the services, like you were saying, that, you're activating these cell responses and you're being able to utilize the vitamins that you have available rather than just processing them out, through your filtration system, through your liver and kidneys, and them just essentially going to waste.
Right, actually putting them to work. So, no, that's a good point. So a little bit about what we are combining on. You have another series or an immune NAD plus, right? Is that what you guys call your injection? Is
the NAD infusion? Yes.
And tell us a little bit about that.
So the acronym stands for nicotinamide adenine dinucleotide. It's an enzyme that's naturally produced in your body. It's an enzyme that once you hit about age 20, unfortunately, which is really early, your body naturally stops producing it and your levels significantly decrease. So by the time you're in your mid 30s to 40s, you've halved your NAD supply. And there's things you can do to help replenish that through diet, exercise, a good sleep hygiene, things of that nature. But you're never going to get back to where you were at the age of 20.
Right.
And so we have this infusion. You can do it every day if you wanted to. Not our recommendation to come in and do it every day, just because there's alternative ways to boost that within yourself naturally. But it's an enzyme that every single cell in your body uses. And what it is it's essentially a hijacker. So it'll take protons and electrons from other nutrients, such as glucose, that are being processed in your body, and it'll drive it down into the cell, into the mitochondria. Mm-hmm. And then once it's in the mitochondria, it goes through the transport channel, is reversed and pushed back into the cell to produce energy. And then your body is able to utilize that energy through every process to function normally.
Yeah. And so where does ATP play into that whole process? Because ATP is our basic energy molecule in our bodies, right? So the enzyme NAD, is that used to break down ATP so you can have, how does that?
No, so the NAD is broken apart into the intracellular part of your cell, and then it's pushed back through the proton channel to be utilized as energy, which turns into ATP.
So it's the precursor to having the ATP that then fuels our bodies.
Absolutely.
Okay. Yep. Perfect. And so that's where the mechanism of the Novathor comes into play, and why we thought it would be such a great pairing is because the near infrared light wave that goes through your body activates the mitochondria of your cell to behave. Again, in your early teens, your 20s, the mitochondria is in full activation, and it slows as we age. And so putting that light molecule into your body can help activate that. So you're getting a huge boost in benefit when you add the Novathor to your NAD injections. So that's kind of exciting to me. I haven't done it yet. I need to. I was hoping to do it. Yes, I was hoping to do it prior to this podcast so I could really speak to it.
Same. I haven't tried your component of it, but I have done the NAD, and it makes a huge difference. I mean, what we would give to feel 20 again.
Right. And to be able to do all the things we did at 20 and all that energy to take care of our daily tasks.
Right.
Yeah. So anyway, but after you did it, what's some of the things that were most notable in the difference?
I definitely didn't feel run down after the workday. I was able to go home and complete some of the tasks and the chores that, I procrastinate until the weekend. And in the middle of the week, it was nice to get those extra things done so we could reserve weekend time for family stuff. But I slept better that night. I didn't feel exhausted or run down when I woke up the next morning.
Nice. That's perfect. I know the Novathor tends to promote a lot that sleep is a big component of that, of the benefits of it. And the mechanism behind it is that you're fully energetic in the day, so your body is ready to rest at night. So you've expended that energy, and you've made that energy available for yourself so that when it's time to rest, your body is really ready to rest.
And you're able to just shut everything down, and you're able to have a restful mind, and you're able to feel 100% good about your day and not worried or, feeling down or depressed that maybe you didn't get some things done that you should have.
Right. You didn't get your checklist marked. You still have plenty you're carrying into the next day. Yeah, I know that can be an overwhelming factor for me as well. So let's talk a little bit about the history of what brought you guys to be. Why did you choose to go down this route of creating an outpatient infusion clinic?
Well, we all worked together at Sawtooth Surgery Center. That's an outpatient surgery center that offers, a very cost-effective way to care for the community and an alternative way to care for the community. And with as fast as we're growing here in the Magic Valley, options are important for people, especially with, individuals not being able to afford insurance or have that ability to have that as a way to invest in their health or care for themselves. We decided having options for people is where it's at.
Yeah.
People oftentimes don't invest in themselves or taking care of themselves because they don't like side effects or they don't like how providers are caring for them. So, our clinic is a way for people to use functional medicine as an alternative to traditional stuff at a cost-effective rate.
That's awesome. Yeah, and I mean, for sure, we're seeing this expansion of our community, and we are seeing a lot of infusion clinics pop up and a lot of wellness modalities put into play, which me personally, I find that so exciting because I feel like there's a need for it and people are recognizing that need and they're getting out there to support that need. When did you guys open your doors?
Just in August.
August of this year. Yeah. And so how many clients have you seen come into your clinic?
We have several clients. Sometimes people don't make it in as often as they want to, but we certainly have a good base of clients already. We're up to about 18 ketamine clients that we see regularly.
Awesome.
We just started medical infusions since we got credentialed through insurance. So we did our first iron infusion today. So that was exciting.
Oh, exciting. Congratulations. Yeah. So tell us a little bit about ketamine. What's the benefits? And you're the only infusion ketamine clinic, correct? Or is there another one?
There is one other that just opened in, I believe, October.
Oh, okay. So shortly after you guys did. But tell us a little bit about ketamine infusions and why that's a benefit.
So the ketamine infusions, while it's not FDA approved to treat depression, chronic pain, anxiety, PTSD, suicidal ideation, there's ongoing research that shows the benefit that ketamine infusions really help with treatment-resistant depression. And through our clients, we've seen a significant improvement in suicidal ideation and anxiety attacks. The benefit of it is that where individuals have been on chronic antidepressants, like the SSRIs and stuff, it targets a different receptor. So it works on the glutamate, which is the excitatory neurotransmitter, to help bring that down and bring people to a more stable mindset.
So it's more on the anti-anxiety process or to help with the depression, or does it still...
It still helps with the depression because it also helps regenerate parts of the network in your mind to help with those pathways. So it helps reconnect those synapses and regenerate the synapses that have broken off or depleted due to chronic stress and depression.
Okay. Fascinating. So, and you said you have now up to 18 clients?
We do.
That's great. How often do you get a ketamine infusion when you're doing that treatment?
So individuals that come in that haven't utilized the service before, it's a 6-treatment infusion that we do over 2 to 3 weeks.
Okay.
And then after you do your 6 series, then you bump out to boosters. The goal on boosters is to get you as few and far between as possible because it doesn't replace the treatment regimen that psychiatric providers have their clients on. It's an adjunct therapy to help regenerate those pathways.
Okay.
So we like to get the boosters out as far as possible, with the goal being once a quarter.
Part of why I know we wanted to work together, Infused Health, and kind of this collaborating effort is so that this community is aware of the other options that are out there. We have a lot of options in measures that people can take outside of going to the hospital and having pharmaceuticals. And what type of stories or client experiences have you seen that have been impactful for clients coming through your clinic?
A large portion of our clients are seeking treatment for depression, the anxiety, PTSD, mental health disorders. And some individuals just aren't ready for ketamine. It's not a venture that they want to jump right into. So our alternative to that is the NAD. So we've had a couple of clients come in, do the NAD infusions, showed a significant improvement in their mood, their energy levels. They were able to get up and deal with some of the stressors that they had, pushed aside, that they weren't ready to face, especially with like the working individual parent that has a lot of stressors and a lot of tasks and, feeling overwhelmed with the monotony of day-to-day
tasks.
Yeah. So NAD for them worked amazing to help get them over that little hump that they were able to achieve those tasks during the week. And again, get back to the weekend of doing things that are actually fun rather than all of the honey-do list stuff.
Yeah, that has to be done. I missed it. Did you have some success stories where they've first did an NAD and then were able to do the ketamine? Has that been a bridge for people, or is it just an either or, like ketamine or NAD for people?
We do have a couple of clients that do both, just to help spread out their boosters as far as we can get them. So they'll do the NAD infusions in between.
Okay. So that's a nice complement to the mental health aspect of the
Absolutely.
NAD. Awesome.
So for anybody that's like curious about getting started into this, do you have any like resources, or where would you point somebody that was curious just to start? Like, can they drop by and ask questions, or what's the new patient experience like?
Anybody's welcome to stop by at any time. We certainly, you can be reached by phone. We answer phone call questions. We typically like to do a ketamine consult if people are looking for options for the depression, just so we can see where they're at in their journey. Certainly our website is a good resource. We do have lots of information and resources on there that individuals can seek out the information and read at whatever's an appropriate time for them.
So we have mentioned how we've been wanting to work together and get this information out to the community. In fact, Mark, one of your co-founders, is that what you call each other? Your business partners? Yeah. So anyway, we've sat down and talked about how vitally important it is that our community is aware of the options that are out there. So we've talked about putting a collaboration group together where we're pulling in multiple businesses through wellness, potentially a magazine so people are aware of what services are out there, trying just to let other wellness businesses say, hey, we offer this service, but if people are asking for a specific service we don't offer, we have a good resource benefit to understand where to find that resource. So I know we get a lot of people through our doors because our therapies are one-offs. They're not a practitioner giving somebody a service. They're coming in for a very specific type of experience, which helps with the anti-anxiety and the stress reduction and can complement very well what's happening in your clinic with the infusions, with the ketamine and the NAD. Just providing that extra atmosphere of, yes, you need to reduce stress in your life. Yes, this injection is going to help you, but you also need to put your place in a space where you're dealing with that physically and emotionally and mentally. So being able to collaborate in this process is something Mark and I thought would be just so extremely beneficial for the wellness community. And would you agree?
Absolutely. As a group of care providers that has, done traditional medicine, been in a place where, the medicines that we're doing are necessary for that particular case, it's so wonderful to step outside of that as people are trending towards functional medicine, and being able to work with other independent providers in the community to just broaden the resources that are available to everybody and really educate the population on how they can better care for themselves amongst our services. Not as a competition between services, but as a group together.
Yeah, because the rising tide, right, of wellness, we're all here to watch this wellness process rise in our community, because preventative health is the best way to combat our health crisis.
Absolutely.
Yeah, there's only so much we can do to fight disease once it's set in. However, if we're preventing disease, we're putting ourselves in such a better position to live optimally.
And when individuals have a good understanding of how alternative medicines or functional medicine is working for them and how it works in their lifestyle, I think we become more invested in how we take care of ourselves. Mm-hmm. And we really look for those opportunities to do that.
Absolutely. I would agree on that. I've noticed when people walk into my space here, they're not always sure how our services are going to help them until they start practicing them and doing them, and then they realize they want more. They want more of what we offer. They want more of this feel-good factor and this making their body the best it can be. And so they start searching for opportunities to expand that wellness model within themselves. So it's exciting to me that there's so many of us who are on that same path of providing this in our community.
Yes, I agree. I certainly hear a lot of clients that come in that have been practicing functional medicine for several years, and they've moved up here, and it's not widely known.
Yeah, it's not
thing.
readily available,
Right.
Yeah, or as well known. Exactly. I mean, it's available. That's what we're trying to let people know.
Right.
Yeah. Mm-hmm.
Are there any common misconceptions or frequently asked questions regarding infusions just in this area? Like you said, it's wellness in general is a new idea to the area. Mm-hmm. What are the most common questions that you get, or things that people might not understand right off the bat?
Definitely a lot of people ask, why would I get this vitamin infused if I take a daily supplement already? I already take my vitamin D. I already take my B12. I already, do all those things. The thing about infusions is once you get those vitamins, they're 100% available for absorption because it hits your bloodstream before it goes through the digestion and breakdown and disposal of the extra leftover nutrients. So you're able to absorb it right away and begin to feel better right away. And it also, some vitamins tend to upset people's digestive tract or give them heartburn or stomach aches or constipation. And so all of those symptoms are relieved through the infusion.
Yeah, well, and there is a lot of the benefits of the digestion. There's a lot of the benefits of the vitamin loss through the digestion process. You only get a certain amount of that at the other side of it, don't you?
Right. It averages about 30%.
Yeah. So that's significant.
It really is.
Yeah. When you're able to get 100% in your infusion process versus 30%.
So we're kind of coming to the end here. For the people listening that are very new to this and curious, what would you say to someone that's kind of on the fence about possibly trying it? Like whether that be financially or just that it's a brand new experience. So that to someone around here, is there something that you would say to someone that's completely new to the idea?
Definitely do your research. Definitely look into the options that are available to you in the community to address whatever illness or ailment it is that you have, whether it's depression, fatigue, anemia, those types of things. And reach out and ask your questions. It's definitely important to get your information from, industry, or not an industry, but a provider.
A trusted provider.
Mm-hmm. Rather than Google or, our Google Doc that everybody has on board. So to just reach out and ask those questions. Infusions, of course, if you're on the fence about them, come in, give it a try. You don't have to sit there for the whole infusion if you decide you don't like it or it's not your cup of tea. And there's really no harm, no foul in it.
Mm-hmm. Yeah. I think that's great. Like, to me, there's only the beneficial side. The risks are so minimal
For sure.
that it's absolutely worth the trial to go in and try it. And that's what we really try to strive for in our wellness center too, is that there's very few risks or side effects that you're going to see with any of our therapies. There's only benefits that are really waiting for you on the other side of taking part. So
and you don't have to wait the 3 to 6 months for your daily medicine to work.
To kick in.
You typically see the results right away.
Yeah, absolutely. We see that as well. So I think that's wonderful. Okay. Well, Marie, I just want to thank you for coming and being a part of our podcast today.
Absolutely.
And sharing with our community what your clinic is offering to our whole community here in the Magic Valley and beyond. So
we're so grateful for the invite and glad we could be here today. And we certainly look forward to working with you and getting this community on the wellness journey.
Awesome. Yes. Well, thanks everybody for chiming in. Know it's perfectly okay to stay salty, and check these businesses out that we're bringing on to share with you all the benefits that are waiting for you.